WUJM St Petersburg.
Good evening, everyone. Welcome to the Doctors in the House Health Show on 99.1 FM, WUJM St Petersburg Community Radio. We have an excellent program for you tonight. Please stay tuned.
From the comfort of my home, welcome to the Doctors in the House, your health show. I'm Dr. Morency, your host. And if you have any questions, because I would definitely love some interaction tonight, call at 727-637-2416. We're still going to talk about coronavirus again tonight, or COVID-19. This is an update. The show is basically then and now. I talked to you about this about a month ago, March 11 to be exact. And here we are now. A lot of things have changed since that time. As we predicted, things have gotten a bit worse since the last show. And this is obviously should not be a surprise, okay? Every expert in the world, including the leading expert here in the United States, Dr. Anthony Fauci, they all have warned us about what's coming. And essentially, they wanted to inform us that if we didn't do the right stuff, we're just hoping that that famous curve, they're talking about that peak, that impact, doesn't come all at once, and that curve would flatten out so that we don't crash our healthcare system. Unfortunately, when you look at New York, I think we're getting close to that, okay? I mean, the loss of life has been unbelievable and unanticipated. And again, my heart goes out to everyone who are in trouble, who have perished, their family, and especially to my healthcare workers, my frontline folks. And I really, really feel for you in the front line. And once again, thank you for your dedication, your persistence, in spite of the fact that you may be risking your life to serve us. So what I really want to intend to do tonight with this show is essentially cover what has happened over the last month or so, and kind of see if we can clarify any misconception that there are, because I'm sure there are people out there that are still very confused because there's two different messages coming out to you, right? And then kind of give you an update what's new, what has happened, and how you can best really continue to protect yourself so you don't end up being a victim of this virus. You know, as a professional, I know I've been a doctor for a long time. I raised a family, do many enterprises. In life, timing is everything. And what I'm telling you tonight is really from a scientific point of view, public health point of view. When it comes to the COVID-19 virus, a great opportunity to impact this virus in a significant way from the start have been missed. And there's still going to be discussion about it. There's still going to be a lot of hula-bula about it and division. But I think follow-up right lets you know to fix the right. And from what I've week or so is that people are, for the most part, are responding to the messages that we got to follow the recommendation of the public health expert in terms of doing those hygienic prevention, trying to apply those mitigation either on a voluntary basis or mandatory basis. We cannot wait for a drug. We cannot wait for a vaccine to be developed. All right, because it would be too late. And yes, there are medications that have been used for during this crisis, both in China and some of the European countries such as France. And I've stated it before in my previous show. When you get a crisis and the outcome is uncertain, you can throw a Hail Mary. In other words, I'm gonna put this drug out there, and if it doesn't really kill you, it might be able to help. But unfortunately, that's not necessarily a scientific way of doing things, because we cannot put people at risk. The hydrochloroquine itself, this is a drug that is 60 years old or more, okay? And this drug has been used all over the place in the medical world for prevention of or treatment of inflammatory conditions, such as rheumatoid arthritis, lupus, and with great result. This particular drug have helped a lot of people. And it's also been used in malaria, okay? And this is the drug that's been experimented in China and France to really see if they can provide some help in alleviate and at least save some life. But unfortunately, hydrochloroquine and chloroquine are drugs that are really, really very toxic. Okay, even when we use it for people with rheumatoid arthritis and lupus and some of those connective autoimmune disease, we have to monitor the patient. And we have to use a much lower dose and still monitor from eye complication, from cardiac complications, from GI gastrointestinal complications, including death, right? So the way to do it, the proper way to do it is really to follow the scientific models. And this has been ongoing right now. People are looking, because the drugs really have the potential to really help. If you look at it at the molecular level, it does prevent the virus from replicating itself, from multiplying, okay? So there's a lot of questions that need to be answered, and they are being answered right now, and this is being put on fast pace so we can have an answer within a very short period of time. So the point I'm trying to make is, unfortunately, there's really no quick fix for this virus. So what has worked for a month ago and even now, more so now, is the fact that those hygienic preventive measures and staying away from one another do not give the virus a chance to multiply, because it needs a body to transmit itself, to grow and transmit itself. And and as I said before, this virus has been able to do this so efficiently and so quickly. All right. But if we really hang on and make the sacrifices, the potential to really make this virus go away faster is there, because we've seen it has happened in countries like China, Singapore, Taiwan, etc. That can be our reality if we take the time to make the sacrifice and basically stay home. Not only stay home, but if we have to go out for anything, let's keep that distance of 6 feet, okay? Because now we know that when you cough, the droplet can actually travel really a pretty good bit of distance, okay? So we have the lessons before us in how to proceed. Okay. Now, having said that, it is obvious that, as I stated before, that in terms of a response to a major epidemic or pandemic this time, that we've made some big mistake. Okay, and we are now realizing that because the first thing to do is really aggressively test, make the test available, make it easy, and make it fast so people don't have to wait, a week to get a result. In the meantime, be out there and transmitting this disease to everyone else. Okay. And what that does is really a couple of things. And now we can talk about in terms of testing, to do a second test, okay, immunologic test, to really decide after somebody's got the infection and survived, do they have immunity? Can they return? Because if they have immunity, they cannot get infected again. And those people can return to work and not have to be isolated for a long time. Okay. And now we're hoping that both the diagnostic test that is not still being done as we speak, and this immunologic testing that everybody's talking about that can really help us plan for the future and make it safe for people to return to their social life, the prior social life, those tests can be made available in a very short period of time. Okay? Because, God, it's like doing something with a blindfold on. You gotta be able to track those contacts and to find those people, isolate them if we have to. Okay? And if they get sick, provide treatment. And those people who are under investigation, people who suspect may have been in contact, really just put those people in quarantine until we can see what happened to them before they go out there and infected everybody. And the last result, obviously, is we're telling folks that because, as we can see in New York, the hospital system is getting so overwhelmed and the staff in the frontline are getting sick as well. So the easier we can make it on the hospital system by staying home, unless we really have serious respiratory difficulty, you cannot breathe, that's a different story, your oxygen saturation is going down, then yes, you go. But short of that, stay home and take care of this naturally. Drink plenty of fluid, rest, and you're going to probably have some suffering. It's not going to be easy. Just like having a serious flu. You know you're going to have the fever, the chills. But if you don't have any respiratory distress and your oxygen saturation, your oxygen concentration is actually adequate, you don't have to go to the emergency room.